Well, I'm not sure every council member. I really don't think I've ever spoken to every council member. There was still ones that I bumped into, were really late. There's nothing else going on.
Imagine being on a boat and not moving and it's 30 degrees and you're like, oh, this isn't bad. And then you're like running through moving water. And then you're like, oh, heads up.
This would be the day, wouldn't it?
Good morning, everybody. Thanks to everyone for joining us on a lovely fall day. I'm Brad Schneider. I represent the 10th District of Illinois, and for today, something I'm very proud of, I have the privilege of chairing the New Democrat Coalition for the 119th Congress. We're here today. As we stand here today, New Dems represent the largest ideological caucus in Congress with 115 members. We were 116, but Governor-elect Mikey Sherrill has stepped away, so we're looking forward to filling that seat. New Dems represent the middle majority of Americans. These are the folks who are tired of the gridlock, tired of the extremism in Congress that prevents us from addressing the important issues they're facing every day in their lives as they're trying to just go from day to day. As we all know, health care is top of mind for these individuals. And for our constituents, we know that, and as their representatives, that's what we're working on. Hardworking Americans are preparing to pay, on average, 114% increase in health premiums. Think about this. They are seeing their premiums double and even triple. Many Americans are going to lose their coverage altogether, all because of the backwards and extreme efforts of this Trump administration and congressional Republicans. That's why I'm so happy to be joined on stage today by some of the brightest minds in our coalition to announce the release of the New Dem Health Care Action Plan. These lawmakers have worked tirelessly to craft a common-sense, pragmatic, and forward-looking agenda that will guide the New Dems' work to lower costs, expand access, and improve quality of care for every American and their family. I want to thank the Healthcare Working Group Chair, Congresswoman Terry Sewell, as well as our task force chairs, Dr. Kelly Morrison, Chantel Brown, Julie Johnson, and Madeline Dean, for their vision and their leadership. I also want to recognize the 5 New Dem doctors who are essential to our efforts on this issue. Alongside Dr. Morrison, we have Dr. Ami Berra, Dr. Raul Ruiz of California, Dr. Kim Schreier of Washington, and Dr. Herb Conaway from New Jersey. Amidst all this chaos and uncertainty, the American people are looking to Congress for a path forward to address the ongoing health care crisis. That's exactly why the New Dems are releasing our health care action plan. Now I'd like to turn it over to our policy vice chair, Nikki Bazinski. Thank you.
Thank you, Brad, and thank you all for being here today. As Vice Chair of Policy, my mission has been to craft a practical, common sense New Dems agenda that speaks directly to the challenges keeping families up at night. Right now, those challenges are all about cost. It's wondering how you're going to afford the electric bill as temperatures drop. It's worrying whether your child will have access to a strong public education, and it's questioning if you'll be able to get affordable, high-quality health care when you need it. In the richest country in the world, these shouldn't be privileges for a select few. They should be accessible and affordable for every person across the country. Now, those sleepless nights worrying about these issues are even more strained as millions of Americans are facing doubling or even tripling healthcare costs. Healthcare is at the center of the cost of living crisis, but the truth is the affordability and accessibility of care has been an issue long before Speaker Johnson and President Trump got their hands on it. It is imperative that we reverse Republican cuts to Medicaid and the ACA, but we also can't just go back to the status quo. We need an agenda that offers a new vision and one that inspires. That's where the New Dems Health Care Action Plan comes in. Our framework offers a new path, a better one one that lives up to our core belief that every American deserves access to quality, affordable health care from providers they trust when and where they need it. It's a comprehensive strategy to address everything from insurance premiums and prescription drug pricing to vaccine misinformation and reproductive freedom. It also focuses on accessibility by strengthening Medicaid and Medicare and closing coverage gaps in rural and underserved communities. As New Dems Vice Chair for Policy, I'm excited to work across to advance this agenda in Congress, and I hope that our colleagues across the aisle will join us in these efforts to make health care stronger and fairer for the American people. And with that, I will turn it over to our wonderful New Dem Healthcare Working Group Chair, Terry Sewell, to talk more about the details of this plan. Terry, thanks.
Good morning. I'm Congresswoman Terry Sewell. I proudly represent Alabama's 7th Congressional District. I want to begin by thanking our chairman, Brad Schneider, for his incredible leadership and all of the members of the Healthcare Working Group for their hard work on this action plan. As chair of the Healthcare Working Group, I stand here today with my colleagues to unveil a plan that puts the health and well-being of the American people first. Right now, families across this country are facing uncertainty and rising costs because of a reckless attempt to dismantle the programs that millions rely on. In Alabama's 7th Congressional District, we are seeing the consequences of the Republican health care crisis play out in real time. Premiums are skyrocketing. Rural hospitals are on life support, and thousands are being kicked off of their health care insurance. Today, we, the New Democratic Coalition, say enough is enough. This action plan is simple and straightforward, but it will go a long way in ensuring that our health care system works for every American, not just the privileged few. Our plan is guided by 3 core principles. First, we believe that every American should have access to quality, affordable health care with predictable costs because no one should have to choose between paying for a prescription and putting food on the table. Second, we believe in strengthening Medicare, Medicaid, and the ACA because these programs are not partisan luxuries, they are lifelines for so many Americans. Third, we believe that every American, regardless of their zip code, should have the access to doctors, hospitals, and medicines close to their homes. To achieve that, our plan takes a series of common sense steps. It would lower costs by locking in the ACA's enhanced premium tax credits and extending out-of-pocket drug caps to Americans with private insurance. It would reverse the devastating cuts to Medicare and Medicaid while cracking down on fraud and abuse. It would close the coverage gap that continues to plague states like Alabama by restoring the Trump administration's $90 million cut to the ACA Navigator program and streamline enrollment. It would also protect women's health care, encourage research and innovation, and strengthen our public health infrastructure. At its core, this action plan is about restoring integrity and security. It is about ensuring that seniors can retire with a peace of mind, that parents can take their children to the doctor without fear of bankruptcy, and that every American, regardless of income or zip code, has access to quality, affordable health care. Health care is not a privilege in this great country of privilege. It is a right, I believe. We are committed to defending that right against those who would undermine it. So today we call on our colleagues across the aisle to join us. Let us put politics aside and put the needs of the American people first. Let's build a healthcare system that reflects the values of fairness, compassion, and responsibility. The New Democratic Coalition is proud to lead this fight. Together, we must ensure that our healthcare system works for everyone, not just the wealthy and well-connected, but for every family in every community, and we are resolved to making that happen. With that, I will hand it back over to our chair.
Thank you, Terry.